for somebody who is highly intoxicated and they need to go get detoxed, they need to go somewhere because they have, been drinking every single day for 3 years, and they could literally die if they stop drinking and go into some type of withdrawal. Or someone that's been taking Xanax, even if they're, maybe not overtaking it, but they take a lot every day. If they run out, their doctor won't refill it, or you feel that they're abusing it, same thing. Like, they could be very medically unstable and could actually die if they withdraw from that. Those people would need to go to an actual detox unit. Some detox units are, again, in a hospital. You go through the ER. The ER determines that you're intoxicated and you're, in need of going to detox. Here's the thing. This sounds really silly to even say this, but you're not going to get on a detox unit unless you either go to the hospital while you're intoxicated or in severe withdrawal at the moment. You can't go say you need to get detoxed and have no withdrawal symptoms. They're just not gonna do it. It's really frustrating because sometimes people don't show withdrawal symptoms, really bad symptoms, until day 3 to 5, which is actually then can be called delirium tremens, which is very serious. That's when people can have hallucinations and lots of medical issues. So, if you think you're going to have a really bad withdrawal situation, but you're in the first couple days and you're not having any symptoms and you're trying really hard to just stop by yourself without any medical help, it can be very difficult those are the days where it's really hard to figure out where to send you, where to go, because maybe you or the person has never tried to stop using, so you don't know if you're going to withdraw. You don't know if you're going to end up having seizure or hallucinations or super high blood pressure or all the things that can happen. So if you, again, are in any way worried that, you're not sure what's going to happen to you, then just call 911 and go to the nearest hospital if you are worried that you're going to have a medical emergency. But if you know for sure that you are in need of detox, you're currently intoxicated, trying to get clean, or in active withdrawal, again, do not bring yourself. If it's strictly intoxication and withdrawal and it's not to the point where you think it's an emergency, then yes, you can have a family member bring you. If you feel that it's an emergency, call 911. Third most common place would be rehab. There are many different types of rehab. There's inpatient rehab where you stay for days. There is outpatient rehab where you maybe go to groups, or you might just go there for yourself, but it's an actual set up where you have to go every certain day. And those outpatient programs also sometimes will help you with things such as Suboxone and medications to get you off of the drug that you were using. If it's alcohol, they're not gonna prescribe something, but if you are taking opiates for a very long time, they may put you on a very controlled Suboxone program. Hopefully it's a very controlled Suboxone program. Some Suboxone programs, we'll get into that at a different time, but in New York State, it's a little bit too easy, in my opinion, to get some of the controlled substances such as Suboxone that are supposed to be for withdrawal, and I sometimes have difficulty understanding why we hand it out so freely. But if used properly for somebody who truly needs it, who has been on opiates and addicted to opiates for a very long time, and they start weaning off of the Suboxone appropriately and try to get off of it as soon as possible, then that's a proper way to use it. Anyways, that's also given in inpatient rehabs, but the outpatient rehab kind of continues with that for as long as they feel it's needed. They'll also do, depending on the place, weekly or monthly drug tests, urine tests, sometimes it's blood tests, depending on the place, to make sure that the person is currently still clean and only has, Suboxone in their system if that's what they are taking, or have absolutely nothing in their system. If you're in inpatient rehab, that's when you hear of like the 28-day programs and all these other 12 steps. Sometimes they incorporate AA into it. There's all different types. Rehab is something that you or me or somebody for you would need to really research depending on what you're looking for. Some rehabs are longer than others. Some are more like a retreat type of feel versus a hospital setting. So also the thing to think of with rehab is that if you send somebody to a local rehab, they're most likely, not as much for like maybe alcohol, because a lot of times the people that go to rehab for alcohol are, not even necessarily drinking with other people. They might be drinking by themselves. I'm talking more like drug users. If you have someone who uses drugs, buys drugs off the streets, they might go to a rehab and know people, and they honestly may end up like getting contact information from other people at rehab, and finding a new place to go buy their drugs. I'm not saying this happens all the time, but I'm just saying, like, if possible, to get somebody out of the area, possibly even out of state, to go to rehab if insurance allows it or transportation allows it, that would be the best way. The majority of people who I personally know, or patients that I've had who have actually gotten clean and succeeded, either went to rehab out of state, moved out of state with their family to just get away from the area, or, had a super, super supportive family. But a lot of times it takes a couple of times of rehab in order to really, truly get clean, because it's not just like, oh, let's just be all better all of a sudden. That's not how it works. So you really do, if possible, need to try and remove yourself from the environment that you're in. If you, if you have a rehab that's in your exact city, and that's the same city that you hang out and party, like that's just not a good idea. You should go somewhere else. Also, that way it's not just a matter of like having a difficult day or a bad day and just like being like, I'm not doing this anymore, like walking out the door. That's happened a lot too, where like the person was like all in, but then they were like having a hard day, and it's like, oh, well, I'm 2 seconds from where I came from, so I'm just going to walk out the door and not finish the program. Whereas if they're away somewhere, it might be like, okay, but like I'm here and I'm just going to do this. And it's not like I can just, walk down the street and find a friend. This is, 1,500 miles from where I'm living, so I have to stick it out and whatever. So that's just my advice when it comes to rehab.